Welcome to Public Health Matters, where we talk about what matters in public health. I'm Jane Goodman, Public Health Network Strategist with the NASHUA Division of Public Health and Community Services. And before we meet our guest today, I'd like to give you a situational update on COVID. You can see from the maps that we are looking pretty good for March 23rd. There's very little COVID in New Hampshire, as far as community levels, and up in Maine, it has moved northward. There is a yellow spot you'll see in northern Maine, so that has moved since last time we spoke. Our COVID-19 community levels in New Hampshire, just to take a closer look, are all low. So you can see Hillsborough County and the entire state are looking good right now at a green level. If you look at the transmission rates from week to week, you can see the COVID-19 transmission. A few weeks ago, we were red, which is considered high, and we've gone down to a yellow, so we've gone down to moderate. So things are looking a little bit better. Our neighboring states are still having some high transmission, including Massachusetts right to the south. They're also moderate, though, for the most part. I just want to remind people that the COVID vaccine is still available. We're really into that booster zone right now, and that children aged 6 months and up are eligible for a booster. If they've had their series, and it's been 6 months, please take those kids in for a booster. If you suspect that you have COVID, please test yourself. We do have tests available at the Division of Public Health. You can call 589-4500. Don't forget the area code, but we do have some free antigen tests available. And if you do become symptomatic and come down with COVID, Paxlovid is widely available now in New Hampshire. You can call 1-800-818-5803. And that will connect you to some telehealth through on-site medical if you're unable to see your own primary care provider. And last, I want you all to skip the flu, but not the vaccine. So it's not too late to vaccinate around flu. We know that it really does help keep the levels of flu down. We had an early uptick of flu back in the fall, and it's not too late right now. So quick, get over there if you haven't done that yet. And now I can introduce our guest, Sue Morris. Welcome, Sue.
Thank you. It's a pleasure to be here.
So nice to have you, and we've tried a couple times to have you here, so finally our schedules are working. And it's perfect because it's National Nutrition Month. Sue is a registered dietitian with Southern New Hampshire Health, and you are at the Diabetes and Endocrinology Center?
Yes.
Okay. So tell me, how long have you been there? What do you do there?
So I've worked in diabetes for over 17 years. I've been at Southern New Hampshire almost 2 years.
Okay. So now you're over at that center.
Yes.
But you do, we were talking a little bit before, you specialize in diabetes education, but also do general nutrition education as well.
Yes, like I see patients that are diabetic, pre-diabetic, gestational diabetes, GI issues, hypertension, cardiac issues, even food allergies, a wide variety. But I must say, being at diabetes and endocrinology, predominantly diabetic patients. Also do weight management.
Okay, so you're busy.
Busy, yes, we're busy.
So I'm just going to use, there were some great things online at eatright.org, and they talked about it is fuel for the future. It's National Nutrition Month.
Yes.
And so we're looking at sustainability and how to fuel ourselves, our own selves, so that we can thrive as we go through. So I'm going to go through their weekly themes, and we're going to add a little bit to that. So
Sure.
And you're the expert, so I'm going to defer to you. But the first was eat with the environment in mind, to go along with their theme. And so enjoy more plant-based meals and snacks. So what kind of plant-based meals and snacks are we talking about?
Well, there are other sources of protein besides meat. Talking about legumes, beans, soybeans, and combination of grains with these beans. So, you know, a meal could be vegetarian chili. Doesn't always have to be chili with hamburger in it. It can be. It's not that animal-based proteins are bad, but having a variety, plant-based proteins, plant-based foods also add fiber. They add antioxidants, and they really shine in some nutrients that are really help us with gut health, with decreasing risk of cancer, with also improving glycemic index, which helps people who are diabetic.
Okay.
So, you know, having meals that aren't always meat-based, but provide plant-based sources of protein, and even snacks, you know, things like hummus with carrots, or even like an apple with peanut butter, plant-based snack.
Those are like two of my favorite snacks.
Me too, actually.
I love the peanut butter, I have to admit, probably
do
more
too,
than I
yeah.
should. So purchase foods with minimal packaging. I mean, that's, you know, I guess if you're going to like a farmer's market or those kind of things. I do bring my own little grocery bags too. Sometimes because I get tired of all those plastic produce bags. I just think so many bags. So buy foods in season and shop locally when possible.
Yep.
So our season hasn't quite begun here, but soon we will be able to like grow things in our gardens and also support the local farm stands. And there are so many in this area, so that'll be great. And start a container or backyard garden to grow food at home. So always a good suggestion, right?
Very economical too.
Yeah.
And you know what you put into the soil, what you're putting into the plants too. And of course, locally, the produce is going to be nice and fresh. You can get information, you know, about what they're using in their gardens, and that's just very healthy. And frozen, you know, in the wintertime when you can't get some of the produce that you enjoy fresh, frozen is good too.
Yeah.
In the wintertime. It's healthy.
And people often don't realize that. Like the frozen is really fresh produce because it's flash frozen. It's it's done very quickly from, you know, when it was picked, and, you know, it's really can be very nutritious. Just got to figure out how to cook them at the right temperature so they're not mushy.
Exactly.
That's just my thing.
Exactly. You do. You have to be, you can't be doing 10 things at once when you're cooking, which is my thing sometimes, and I forget I got it on the stove or whatever. But yeah, definitely. And economical too, especially for people who live alone. You know, sometimes buying things that are fresh at times isn't economical because they may not use that whole head of lettuce before it goes bad. But when you get things that are frozen, you can take a portion out at a time.
Sure.
And
just seal it up and put it back in the freezer.
Yeah.
So this is all good advice for me too, personally, not just for our viewers. So I do appreciate it. So the next thing is see a registered dietitian. I don't think you're going to argue with this one. And I wanted to talk to you a little bit more than to dig a little bit deeper, because one of the reasons we want people to see a registered dietitian, especially if you're living with a chronic disease, is that there are different diets that are more appropriate for different things. So I know you brought a few things to show us, but, you know, for example, and we'll never get into all of them now, but like for diabetes and pre-diabetes, we know that type 2 diabetes can be preventable and controlled through diet. So just give us the highlights of, you know, why do we need a dietitian for this?
So that's a really good point. I think there's just so much out there in the media that can be confusing, and recommendations, for one thing, may not be appropriate for some other type of you know, condition. So if a registered dietitian can, first of all, meet with the client and assess what goals, what are your goals, and then do a nutritional assessment, and then come up with a personalized, individualized plan that treats the condition, that treats the diagnosis that's appropriate for the person, and working in collaboration with the client. So like, for instance, with diabetes, we want to consider getting an assessment of a person's diet and what the macronutrients are that they're already consuming, how much carbohydrate, protein, and fat. What can be tweaked in that with those macronutrients to decrease spikes in blood sugar. So, you know, and instructing things on how to read a label to help with blood sugar spikes, and how to combine protein with carbs. I mean, there's so many things that a person who is diabetic or pre-diabetic can do to really decrease those blood sugar spikes and still have an enjoyable meal plan. But definitely for diabetes, it's low glycemic carbohydrates, combining them with heart healthy fats and protein, and portion control throughout the day.
Yeah. So what about cardiac?
So cardiac too, they all have similarities. So cardiac would also be a diet that's high in fiber, especially water-soluble fiber. That all helps with lowering cholesterol. That's got heart-healthy fats and also has a nice combination of healthy carbohydrates with lean protein and heart-healthy fat. So, and also usually cardiac issues too. And even with diabetes, limited amount of sodium, being careful with sodium intake. So typically, these diets have a lot in common.
Sure.
You're really trying to encourage people, and even people for weight loss, encouraging them to eat foods that are higher in fiber, more complex carbs, lean proteins, and heart-healthy fat.
So let's back up, because complex
Yeah.
carbs, not everyone understands what that is. So that might be your grainy breads, possibly.
Yes.
Is that like there's a difference between brown rice and white rice, or how do we get to the? How do we figure out what is complex and what isn't?
So probably a better way to word that would be lower glycemic carbohydrates.
Okay.
And so carbohydrates that tend to be higher in fiber and less processed tend to just take a bit longer in the digestion process. The fiber kind of slows things down so that the sugar goes into the blood in a little slower manner, so that it gives the insulin enough time to handle that rise in that blood sugar.
Okay.
And so that's beneficial for people who are diabetic, beneficial for people who have cardiac issues, because fiber it really helps with, especially water-soluble fiber, can help lower the cholesterol. And also for gut health. Again, a diet that's, got a lot of plant foods in it, lean proteins, heart-healtty fat, low in processed foods, more, foods that haven't been, haven't had preservatives and chemicals in them, are healthy for a myriad of health issues.
Sure. So you said lean protein. So let's just give everyone an example: fish, chicken.
Fish, chicken. Red meat isn't out of the picture. Limiting red meat is a higher fat protein than your fish and your chicken, but once a week, something like either round roast or a 90% lean hamburger. Having red meat once a week. Also plant-based proteins, things like your lentils, your legumes, your are great sources of protein that can be incorporated as a substitute for animal protein.
Chickpeas.
Oh, chickpeas, yep. The lentils and legumes. So
I'm thinking
chickpeas,
it's,
black-eyed peas, kidney beans,
members
all
of my
those.
family have experimented with being vegan, vegetarian, and all the recipes we have to try, and we ate a lot of beans for a while.
And there are all sorts of beans, all different varieties. And so with plant-based, there are analogs too. There are plant-based, hamburgers and hot dogs and things like that. But again, it's good to be a label reader and look at the ingredients, because some of these things that are processed can have a lot of additives in them that may not be as healthy. So the more the food is less tainted by man and more that it's in its original state, tends to be healthier for us.
Less tainted by man.
Less tainted by man. Tends to be healthier.
Well, and salt is a preservative, so a lot of these packaged foods are very high in sodium. Flavor enhancer, all of those things, but they tend to be very high in sodium, and that, you don't want to use your whole intake on like canned soup.
Exactly.
So you just have to be really careful.
And do you know, in the Western society here, the major source of sodium is not the salt shaker, it's the processed foods. Processed foods and eating out with all of these additives.
So almost better to like make your own rice and then add, just that teeny little bit of salt yourself than to use a pre-packaged, like rice package, for example.
Exactly.
That comes with the flavorings, because that's 25–30% sodium.
Exactly. And you can check the sodium level on the label. Now, that's not to say that salt is low sodium. Salt is not. A teaspoon of salt, which is about the size of my tip of my thumb, has about 2,300 milligrams of sodium in it. So for sure, if a person has high blood pressure and they need to limit their sodium, they don't want to be shaking the salt shaker on everything. But really, processed foods, if you look at the labels on some of these things, as you mentioned, soup, you eat a whole can of soup that has 2 servings in it, that's approximately 2,000 milligrams of sodium right there. So the processed things, prepackaged things, again, things that man has manipulated can be 10 to high in sodium.
Yeah, so the message is to keep it fresh.
To keep it fresh.
As much as you can.
For a lot of conditions, yes.
Yeah.
Yeah.
So the third thing is to stay nourished and save money. So this is about planning your meals and snacks, kind of having a plan each week so that you know what you're going to be eating. See what food you have at home before purchasing more. These are good tips. And then the one I want to skip to is learning about community resources, such as SNAP, WIC, and local food banks, because we do have people that just can't afford some of this food. So I did want to give a shout out for SNAP benefits, WIC benefits for moms and children, and that's usually your bread and your milk and your cheese, and it's very specific.
Yes.
But it's a nice supplement for new moms that are potentially low income and having trouble getting those fresh foods.
Exactly.
And SNAP benefits, I believe it was reauthorized in New Hampshire as well, that you can double your money with your SNAP benefits at the farmers markets. So that is a great benefit that is available. And just, again, encouraging that consumption of the fresh vegetables and the fresh fruits. So much better for everyone.
Yes.
And then a little shout out that we have New Hampshire Easy, nheasy.nh.gov. And if you go on that website, you can enroll in SNAP benefits and all the other programs that are available out there.
And even Googling the food pantries. There's a lot of food pantries in the area, and that, again, is such a great resource for people. The groceries are expensive, and meal planning, trying to get things when they're on sale, using leftovers. I think meal planning is a big thing. Many times, people can know what to do. They know what's good to eat, what's not good to eat, but we can have all the best intentions, but if we go home and it's not in the refrigerator, we have a problem. So doing like a menu for the week and then planning a grocery list from that. And even before doing the grocery list, and even before planning the menu, look at what you have in the house already. And really working, if there's something left over from last night, trying to incorporate it into another dish. It's definitely economical. It's good for the environment. We're not wasting. And it's just, very frugal.
Yeah. I've been doing that on Sundays. I'm going to pat myself on the back. But we always have all these leftover vegetables, little tiny thing. I'm like, we're eating all of these vegetables. I am not throwing them away.
Yes.
I'm a big proponent of leftovers. Or if you make a big chicken, then use the chicken in something else.
Yes.
Whatever's left. Or I'll make a soup, or just to, can just throw it all in a pot. It's very easy.
Yes, because eating out is really expensive. And also grocery shopping, if there isn't a plan in mind, it really can add up. And one of the things with leftovers too, if you put when you package them, as you mentioned, Jane, putting a date on the container, and so being mindful of looking at that date helps people to kind of be mindful. I better use this.
Get it out of the
get
fridge.
it out of the refrigerator, before that 7 days, 5 days, 7 days has passed. And so it kind of helps to be organized then and making sure we use those leftovers and that we're not throwing away food, which again isn't frugal and it really isn't healthy for the environment.
Right, yeah.
We have a lot of waste.
So much food.
We do.
Yeah, it's kind of distressing in a lot of ways.
It is. You mentioned a couple of good websites. One that comes to my mind too is myplate.gov. Myplate.gov is a great website for just healthy nutrition recipes and ideas. Eatright.org, and also too a number of Hannaford's offer registered dietitian services, and you have to Google and see which one. If you have a Hannaford in your area, you can call their courtesy booths and they'll be able to tell you if they have a.
I know they do it right in NASHUA too, because I've seen their booth and I've seen the dietitian there.
And it's a free service that you can. They'll do a grocery tour one-on-one. They even do classes, and again, all these nice resources that can help people with their health and to fuel well for the future.
Yeah, That's great. Great. So, and we'll put up some of those resources at the end too, so people can, if they're going to run for their pen now, they can wait a second because they'll come up again.
Yeah.
So, and eat a variety of foods from all food groups, and including your favorite cultural foods. Eat foods in various forms: fresh, frozen, canned, and dried. You just mentioned the frozen foods. We've talked about fresh. Canned, again, got to be a little bit careful. Like a canned soup versus a can of beans is a little bit different as far as like sodium content and that kind of thing. Dried, we didn't think to mention that. Avoid fad diets that promote unnecessary restrictions. So I think that is really important to keep in mind. It's very hard to restrict.
It is, and each food group shines in something. So when fad diets tend to eliminate one or more food groups, and fruits and vegetables shine in fiber and antioxidants and phytochemicals that are really important for our health in a number of chronic illnesses. And whole grains too shine in vitamins and fiber and other nutrients that our body needs, as well as protein. We need protein, the building block of our bodies, and heart healthy fats. And so when we follow something that eliminates 1, 2, 3, or 4 of those, we can develop some deficiencies. And also, it can be very hard to sustain. Some fad diets you will see, you'll lose weight very quickly. But many times people can't stay on something so strict, and so they end up regaining the weight back plus. Or causing deficiencies. It's good to have a good balance.
Yeah. So I'm going to have them pop up the right proportions, which was from myplate.gov, which you just mentioned.
Yes.
And we used to have like the big food pyramid.
Yes.
And now we have a plate, which kind of makes more sense. We eat off a plate, not a pyramid. Although I don't think the pyramid's completely gone away. I think you brought something to show us about that. But in this particular thing, we have the exact colors, but we have fruits and vegetables on one half, so that's taking up most of our plate. The grains that you mentioned, so I think you mentioned whole grains and very fibrous grains.
Yep. And starchy vegetables like beans, corn, peas, even potato could be considered in that category as far as it's a carbohydrate. They're starchy vegetables that also provide fiber. They would be like in the carbohydrate section, grains and starchy vegetables, which could be a quarter of that plate.
Sure. Okay. And then protein, of course, we talked about that. So it's laid out very nicely in quadrants, really.
Yes.
And then we have the dairy, it seems like they want a little bit less dairy, just like a cup of milk or a...
Well, which would be
really
a serving.
Sure.
Yeah,
a serving.
So on the outside of the plate, again, dairy is another food group. I think I forgot to mention that, which provides calcium, and also milk is fortified with vitamin D, and it has other nutrients in it. And so, the plate is a nice way to portion your protein, your starches, your fruits, your vegetables. And then on the side, a cup of dairy would be a serving of dairy. So see, you're getting a smattering of all the food groups. And
that's with every meal.
Right.
Yeah. Which is a little complicated for some meals.
So a good rule of thumb is this: you may not have like 5 food groups like that present at a meal, but having at least 3 food groups present, one of them being a source of protein, which could be a meat protein, a plant protein, or even dairy. Dairy has protein in it. And also having color at the meal. So whether it's a fruit or a vegetable. That's the minimum for a balanced meal, and maybe a little heart healthy fat. So at least 3 food groups, color, and a source of protein. And so it gives a little
meal
more flexibility.
planning as we speak.
Yeah.
So the last thing, make tasty foods at home. We talked about the expense of eating out. So learning cooking and meal prep, and we have a great program here called Cooking Matters. So teaches folks how to cook their meals and how to use the different things that we have good access to. Helps you try new flavors and things from around the world. It's as if you wrote this, Sue. Find creative ways to use leftovers. So that's another thing. And then it creates happy memories. We always have a family meal together, so we can't enforce everything, but it is really great if people can have a meal together.
It's a gathering time. You know, it tends to be one of those memorable family times, eating a meal together, and even with friends. You know, it's always been associated with that. You know, I want to speak one thing about the plate. So when we talk about the plate, it doesn't negate being a vegetarian.
Sure.
Because really, you had the plate there. I don't know if you want me, can I hold this up?
Yes, of course.
So this is a plate too. Now this isn't a vegetarian plate. The source of protein is, you know, lean beef. And again, you see some type of a starch and you see color with the vegetables. But this could also be a plant-based protein.
Sure.
It could be legumes. It could be, you know, chickpeas. It could be tofu.
Yeah.
So, you know, you can have the plate and be vegan, be lacto-vegetarian, be, you know, just a regular diet. Again, it's about the mix and the match and thinking, do I have a source of protein? Do I have color? Do I have some fuel? You know, so we can be very flexible.
Yeah. It's fun to hear you say that about color, because those are words that my mother always said, like, you don't want to have an all white plate. You know, so she always had the protein, the starch, the vegetable, and I've always thought about that with the color, so, you know, go mom. So I'm just going to pop these resources up, eatright.org, grownashua.org for some outdoor gardening, the Nashua Soup Kitchen and Shelter, New Hampshire Easy for our benefits, and Cooking Matters is another resource in our community. Thank you, Sue, so much for joining us.
Pleasure being
I
here,
really
Jane.
appreciate this. We could probably talk about this for a long time. But I do have to give everyone some reminders that courage is knowing when to ask for help, and that you should first talk about some mental health issues with your primary care provider and whoever you're seeing, and don't wait. So we're encouraging you to get back to your providers. A lot of people didn't see their doctors, even during COVID, and even though we are moving away from that, getting back to the new normal, people still need to get back to those primary care providers. Make sure that you're asking about your blood sugar and you know your numbers. If it's over 100, it's a little bit of an alarm bell. So that might just indicate that you should also find out your diabetes risk. And finally, is your blood pressure over 120, over 80? Again, know your number, speak to your provider. Want to let folks know that we do have clinics at Nashua Public Health. We have immunizations on Tuesdays from 4 to 7 and on Fridays from 9 to 12. And at those clinics, we also do lead testing. And you do need an appointment, so you want to call 603-589-4500 and press option 2. And we also have a sexual wellness clinic on Thursdays from 3 to 6 p.m. So thank you all for joining us. We hope you have a great week. And remember, public health matters.